post-transplant patients. All these are integrated in our curriculum. But still, we insist because of the, especially during our internship, this change to elective posting instead of compulsory posting, that should be integrated. We'll escalate to NMC for that compulsory posting of tuberculosis, respiratory medicine for internship at least a week. And one more thing is, we as a teaching program, we have continuous medical education system, continuing medical programs and seminars, plus core committee is conducted bi-monthly in all the medical colleges. But the core committee is not involving the undergraduate students. So year afterwards, we'll insist the undergraduate participation in the core committee also. So I think this important is to end TB by 2025 with the inter-directorate on prevention. As SASAD defeats SASAD prevention, but motivation and mobilization of the population to avoid that social stigma as shown in the video is most important thing. And not only this, it is not asymptomatic, like extrapulmonary tuberculosis in most of the children we came across, that teams of our experts are doing a wonderful job with the research, and a lot of drugs are incorporated by the government. With that support, I think we can end TB. Thank you.
Thank you, Doctor. Thank you so much for your kind words. To present with the next wishing note, I would like to call upon Dr. A. Shanmugakani, the Director of Medical and Rural Health Services, who has dedicated 30 years of professional life in Directorate of Rural and Health Services. A pediatrician by qualification, she has played a major role during COVID crisis as a joint director in Viluppuram and Kallakurichi districts. உங்களுடைய கரகோஷத்தோடு I would like to call upon மருத்துவர் A. சண்முகக்கனி, மருத்துவம் மற்றும் ஊரக நலப்பணிகள் இயக்குனர்.
மதிப்புக்குரிய மருத்துவ மற்றும் மக்கள் நல்வாழ்வுத்துறை அமைச்சர் அவர்களுக்கும், நமது மருத்துவ செயலாளர் அவர்களுக்கும், MD NHM அவர்களுக்கும், WHO consultants, Madam Soumya, மற்றும் directors, and my dear brothers and sisters. I would traditionally like to wish you a very good morning, but because I am very plain speaking, I don't think it is a very good morning because it is very, very hot outside, though we are sitting in a cooler temperature. And with that, I would like to go on to speak about tuberculosis. As students, you all know that this Mycobacterium tuberculosis, acid fast bacilli, we keep on telling the Lowenstein-Jensen culture media is the gold standard. It spreads by contact. It has got pulmonary, extrapulmonary components. But actually speaking, when you go out and you do your specialty and start practicing, we simply forget about this entity called tuberculosis. This Mycobacterium tuberculosis, as we all know, is ubiquitous. It is in the air, spreads by contact. Now, what we generally tell our young doctors is that at least 2% of the OP that you see should be screened for tuberculosis. So, அந்த காலத்துல நம்ம வந்து open TB கண்டுபிடிக்கிறதே பெரிய விஷயம். இப்போ வந்து open TB கண்டுபிடிக்கிறது is not at all, I don't think if anybody finds an open TB, that person should be congratulated. அந்த அளவுக்கு நம்ம விடவே கூடாது. You all know how early diagnosis is very important, and nowadays we have this CBNAT and TrueNAT, wherein which we don't have to wait for weeks together to diagnose. You all know that oftentimes that TB is diagnosed indirectly only. It is diagnosed through radiological measures and by clinical suspicion. But we are now living in times where by this RT-PCR, PCR and TrueNAT and CBNAT, these kind of recent advances, in hours we are able to see, to tell whether the person is positive or not. So with this, what we do as clinicians, we look for cervical adenitis caseating material, and we rule out everything, and then we think of abdominal TB. It is a multi-organ involvement, as we all know. Doctors, we know that how it involves every organ in the body, including the eye. Okay. Now, even today, say about a week ago, I saw on WhatsApp in a maternal death, a 7-month amenorrhea woman has been diagnosed, towards a critical stage. She passed away. It was a maternal death. And the cause of death is miliary tuberculosis. So she has been missed all this while. What is the point in diagnosing, when she is in a ventilator, on a ventilator rather? So I would impress upon you to try to diagnose early. Have this element of suspicion always in your minds. It is just not cough. It's just not fever and fatigue and night sweats and loss of appetite. It's just not that. It manifests in several ways. In fact, in children, we roll out everything, and then when a child is brought in a coma or with meningitis syndrome or bizarre symptoms, then we conclude it is TBM, and it turns out to be TB meningitis. So we must always have a high level of suspicion when patients come with bizarre symptoms. So that is one thing. And you all know how such an immunocompromised status TB is. So it will easily go and affect a post-transplant person, a person with, who's on dialysis, cancer patient, HIV, all these are immunocompromised status, and it partners with these diseases because it can already damage the immune system, and it goes and further wreaks havoc. So with this in mind, and I think I've come to the end of what I really wanted to say. And this COVID pandemic, though it has been terrible, but we were all walking around with masks. So that way probably it wasn't spread too much. But we also felt an advantage in the sense so much of CTs were taken, so much of X-rays. And so retrospectively we were able to diagnose. So the numbers came out high, mainly because I feel personally, is because of the retrospective examination of imaging services which were undertaken during COVID period. So with this, I would expect you all to diagnose, early diagnosis, and because if you, there's no point when in treating after a parenchymal damage has already happened. So early diagnosis and treatment, I am sure by say in about 2 years, we can completely eliminate TB, though it is ubiquitous. Thanks.
Thank you, Dr. Shanmugani. Thank you so much for your kind words. And up next, I would like to call upon Dr. Soumya Swaminathan, MD, FA Science and FNA Science, FA MS, FNA, the chairperson of MS Swaminathan Research Foundation, the director of NIRT, National Institute of Research and Tuberculosis, and ICMR, Dr. Former Chief Scientist, World Health Organization, Geneva. And she currently serves as the chair of the Board of Trustees of the MSSRF in Chennai, and leads the foundation work in areas of biotechnology, ecotechnology, fisheries, agro-biodiversity, and rural livelihoods. She plans to develop new areas of work in climate and health, tribal health, and improving nutrition through attention to food systems. With all your applause, I would like to call upon Dr. Soumya Swaminathan, Munnal Thalaimai Ariviyal Ariஞர், Ulaga Sugadara Nirvana Thalamayagam, Geneva, to address the gathering.
Vanakkam, Honorable Health Minister, sir, Mr. Bedi, welcome to the health community. I think everybody is excited that you have taken over as Health Secretary. Dr. Selva Vinayagam and my dear friends and colleagues on the dais and off the dais. It's very encouraging to see the Tamil Nadu government taking the leadership and having a very concrete plan for TB elimination in the state. As you know, we do have a national goal of TB elimination by 2025, but there is also a global goal of elimination by 2030. And because we're starting from a very high baseline, India's, as you know, is the home to 1/5 of the world's TB population. So the world's global goals cannot be met unless India is making progress. Apart from that, of course, it causes a lot of suffering. I think that is the main reason we want to reduce the TB burden, because not only does it cause a huge number of deaths, even today, we are talking about 1,000 people dying of TB every day, which is really unacceptable. You know, even for one COVID death, it is reported in the paper But how many times have you seen a TB death being reported in the paper? So, sir, my request is that we have to elevate this to a much higher level. How COVID was elevated. The Prime Minister was monitoring. He had empowered groups. The Chief Minister used to chair the COVID committee. All decisions were taken at that level, sir. Every case, every district, what is happening, every death was being monitored. So, my request is that our Honorable CM should form a committee that will once in a while review the TB status, and that means also that collectors must review what is happening in their own districts. Today we have a state-level TB prevalence survey that has been done, and Dr. Padma Priya, I think, will be presenting the main findings. We know there are some districts which are at much higher prevalence than other districts, and probably because risk factors Dr. Anjali was mentioning. So poverty, undernutrition, of course alcohol, smoking, diabetes, these are the major risk factors. And so there are, I think, 10 districts which are above the cutoff for Tamil Nadu average, but there are 5 districts where it is very high: Ariyalur, Perambalur, Madurai, Theni, and 1 or 2 more. So we need a special focus on those districts. And the other districts which have quite low, we have on the other spectrum, those districts can move towards elimination quite quickly. So I think we have both the spectrum in the state, some districts already quite low, and some districts which are very high. They are higher than even national average. The second is, if the collector is monitoring, then only 3-4 things they need to ask actually every month or whenever they have the district review meeting. How many patients had a molecular test, what we call as NAT? Today I think, prevalence survey. Dr. Asha, what percentage of patients get a molecular test today? 20%? 90? 90% of the patients are getting a molecular diagnostic. But we're conducting 15 lakh tests. Yeah. But not all 15 lakhs are getting. Yes. So I think this is a problem not only for Tamil Nadu, but for all states. But if we have to do elimination, the first thing is diagnosis. If we are still going to use smear microscopy, we are going to miss at least half the cases. So we can forget about elimination. So I think if one change has to be made, it is that every presumptive TB case must get a molecular test upfront, not after smear microscopy. The first test has to be a molecular test. That one thing alone if we are able to do, which means Tamil Nadu will have to put more finances, because central government will supply some cartridges. We are only with those cartridges and those machines, we cannot cover 100% of our cases. So we have to put money. We now have many multiple Indian companies also who are manufacturing diagnostic tests apart from the Cepheid, which is what we have used all these years, and these have been approved by Central TB Division. So we should saturate all the centers, either TrueNat or whichever ones we are using approved, and we have to make sure the supply chain for those cartridges is properly managed. I think this is the most important thing. Second is the use of X-rays. We know that by X-ray, I think DME and DMS were telling that during COVID we did so much of X-ray and CT scan. We have the capacity, sir. Even during COVID we did so much of RT-PCR also. We are not using all the capacity we have in the state. In high burden settings like in cities, we could rope in some of those labs actually to do the PCR. We don't have to depend only on what the TB program is having. We can rope in private and public sector labs. And for X-ray, now we have artificial intelligence reading of X-ray. So we don't need radiologists to read the X-ray. And there are again some companies with approved AI solutions. Why not Tamil Nadu be the first one to roll it out at the state level? Because Central TB Division has been saying it's a good idea, but not rolling it, scaling it. So again, I think that's another one which we can detect many more cases. Sir, one thing this TB prevalence survey showed is a very interesting finding, but it makes it challenging for elimination, is that a lot of patients who had culture positive TB did not have symptoms, or they did not go and seek care. They had minor symptoms. We saw in the film also that person saying, irumbal irukku, it will go off the pani kalam, illa na adadu jillunu kudichutten, some excuse, for cough. So many people are not going to ask for TB, even suspecting TB. So we need awareness campaign. In the past, I think Dr. Nalini is here. We had Surya and other actors. They became TB advocates. So I think we need both to address awareness and to address stigma. We could have again a big advocacy and awareness campaign where just like this film, this very nice film which showed how awareness on TB diagnosis and treatment can be. So congratulations on the film, but I think we can do also more on that. And then on the private sector, because without private sector involvement, we are not going to solve this problem of TB or anything in health. We know that a lot of healthcare is provided by the private sector. There have been models which have been shown to work. One model is this FAST model that was mentioned, where you have somebody in the hospital setting who's a focal point for the communication with the TB program. You also have the Nakshatra clinics. The Nakshatra clinics were actually tested during the Zero Chennai free TB free Chennai program, which ran for the 5 years from 2015 to 2019. One of the interventions there was selected private clinics were named as Nakshatra clinics, and there are about 40 of them in Chennai today. These clinics actually agree with the government that they will follow a standard protocol for diagnosis and treatment. The government gives free diagnosis and free treatment to the patient, but the patient continues to stay in the private sector. We don't take the patient away. And they are supposed to, of course, notify on the patients as well as the treatment outcomes. And they had a nice system called the TB Nanbans, who were like the treatment supporters for the patient. So I think the private sector, we have to keep them closely engaged. And by providing free diagnosis and treatment, we can reduce the burden onto the patient for the catastrophic costs. Finally, I think integrating all this, is going to be important ultimately through primary health care, as Dr. Anjani was mentioning. And again, this Nakshatra model showed that when you have TB patients, you screen them for diabetes and hypertension, not just the patient, but the family members, you're picking up a lot of new cases of diabetes and very poorly controlled diabetes, both the patients and their household family members, and hypertension. So it gives an opportunity to also provide them with NCD care and, of course, counseling. So again, we have to look at the patient as one person, not as a disease that we are treating. And one individual will have many physical and mental health problems which need to be addressed. And finally, I think the treatment, the patients themselves, the survivors, the TB champions, again, REACH had worked to develop a whole network of these women, mostly women, but also men TB champions. And we have these very well motivated and trained people. They are in the community. We need to use them. With a small incentive, I think these TB champions could be extremely useful. They can be also the link with the Panchayati Raj institutions, because I think that again is a missing link, that the collector needs to be involved, the Panchayati Raj institutions need to be involved if TB elimination is going to be a reality. Thank you very much.
Thank you, Dr. Soumya Swaminathan, for enlightening ideas and suggestions. Up next, I would like to call upon Mrs. Shilpa Prabhagar Satish, IAS, currently serving as Mission Director, National Health Mission, with additional charge of Special Officer, Mudalvaran Mugavari. She was the first women collector of Tirunelveli district. She has been awarded Effective Implementation of Plastic Ban for the year 2019 from our Honorable Chief Minister of Tamil Nadu, and the Digital Transformation Award for the year 2019 from New Delhi. Ladies and gentlemen, please put your hands together and welcome Tirumati Shilpa Prabhagar Satish, Desiya Nalavalvu Kuzhuma Iyakunar.